Hey, my name is Kara. I'm an ultrasound tech, and let's talk today about one of the three findings in the second trimester anatomy scan that, if we do see on your baby, it is considered abnormal, but in the absence of any other markers, it usually amounts to nothing. And before I get this video started, definitely be sure to check out my new group that I made for new as well as current moms. It is just a place where I thought we could find a sense of community as well as me answer some questions that you guys have in a better format than on these TikTok comments because the character limit kills me. Anyways, this first video is going to be about an echogenic intracardiac focus, and that is going to be in reference to baby's heart. So, what an echogenic intracardiac focus is just a bright spot in baby's heart. What this bright spot is suspected to be is just a microcalcification on baby's heart muscle. So, what that means in just normal terms is a bit of calcification or calcium that is seen on the heart muscle. It is a pretty common finding in the second trimester anatomy scan, and up to 5% of pregnancies are going to have this spot on the heart. And it is so common in Asian populations that we actually don't even use it as a soft marker anymore. So I thought it would be helpful for us to take a look at a regular four-chamber heart, which is depicted in the picture up here. So you can see that on the top there, those are the two ventricles, and then on the bottom here are going to be baby's two atria. And you can appreciate that all of the spaces inside the ventricle and the atria that are blood-filled are just black, as in they are just filled with fluid. This is different than this picture down here, where you can see that there is just a bright spot within the left ventricle of the baby's heart here. So again, these are atria down here, and then the ventricle are going to be up here. And you can just see that bright area where the arrow is pointing to, and that is what we are going to call an echogenic intracardiac focus. Usually these do just go away on their own in the third trimester, and they are so common that usually we don't do any sort of follow-up on them either. And although heart problems are the most common congenital heart defect in baby, if we see an echogenic intracardiac focus in the absence of anything else, as in everything else looks normal on baby, it is nothing to worry about for the vast majority of cases, unless, of course, you have other things present or other soft markers present that could indicate an underlying condition such as trisomy 21. But if this is the only thing that was noted on your ultrasound, and by the way, a lot of the time the radiologist doesn't even report on these when they are seen, just because, again, they are so common and usually don't amount to anything. If there is no other abnormalities seen, then it is nothing to worry about. So if you have been told by your doctor that something was found in baby's heart that is an echogenic intracardiac focus, please try not to worry about it. It should go away on its own in the third trimester and will have no long-term implications for baby as long as there are no other abnormalities found.